While many people may be trying to get in shape for the new year, our next guest says achieving that goal could actually make you look older.
Here with the explanation and solution is board-certified dermatologic surgeon Dr. Dendy Engelman. Welcome to the show.
Thanks for having me.
Okay, so you have to clear something up for me. What is a dermatologic surgeon?
It's a mouthful.
Yeah, I was like, what is that?
So those are dermatologists who do extra fellowship training in skin surgery. So we do benign and malignant removals of skin cancers or aesthetic procedures if someone didn't like a mole or something. So we take it off and make it heal and look pretty.
Okay.
Now, most people feel that if they work out, they're going to have a more youthful appearance.
Right.
But you say otherwise.
Well, that's the caveat that's really tough. Like we're all New Year's resolutions, everybody's eating right, we're getting healthy, we're exercising, going to the gym more.
Yeah.
But the problem is sometimes that can wreak havoc on our face because we're actually losing volume. And fat is a natural filler. If you think about someone who's overweight, they frequently look pretty young because they have a lot of volume in their face. But as we age, not only do we have time marching along, but if we're exercising a lot and really stressing ourselves, sometimes we can lose volume through the face and that makes us look older.
So is it like a sucking in effect? I think we have some pictures you can show us what exactly happens when you lose this volume in your face?
So as we age, we think about the youthful triangle where we have high cheekbones and full apples of the cheeks, and we have an inverted triangle that kind of looks like this, and you can see in the before and afters, see that nice curve that the one on the left has. And then as you age, we frequently will lose that volume, and we have the sagging and kind of the jowls through here and the hollowness through the cheeks. And so that tends to make us look aged without someone thinking, you don't have a lot of wrinkles, you just look older.
Is there anything that you can do to actually prevent that volume loss?
So that's
to prevent it.
Right. So that's an excellent question. I mean, I think that you can be smart with diet and exercise and try not to do huge volumes of loss and yo-yo dieting and all those kinds of things, because we frequently, unfortunately, when we go on a diet, we don't say, I'm going to do these extra 10 miles for my abdomen. We don't know where that fat is being removed. And frequently, if you lose a lot of fat in the face, then it makes you look older. So we can't always pick and choose where it's removed.
Now, just to be clear, I don't want people saying, I'm not going to the gym because I don't want to look older. It's like very rigorous exercise routines, losing weight, all that combined, when you're just pushing and going, you're not taking care of your full body, that this happens, right?
In addition to the age-related changes that occur. As we all age, we actually resorb bones, so our structure, our scaffolding of our cheekbones gets smaller, and then also we lose collagen, and that fat pad just kind of migrates and goes down, like we talked about, that age triangle. So we're trying to restore volume by adding in volume through the mid-face to make us look much more youthful, but not like you've been worked on. So it's a really fun, subtle technique.
So how do you do it?
Yeah, exactly. How's it done?
So I use hyaluronic acid fillers like Voluma, which is one of my favorite ones that's indicated. It's the #1 filler that's used and FDA approved for this region to help maximize volume through the cheeks, lift up the face, and make us look less aged and less tired.
And you actually have somebody here. We have a model with us right now, and you're going to show us the procedure
I will show
that you do to bring back that youthful look.
Yes, so we have Brittany here.
Hello, Brittany.
Hi. And Brittany's actually getting married.
Ooh,
oh, you are?
Congratulations.
When's the wedding?
In May.
Okay, so you're getting ready for that. You want to look the part.
Exactly.
You look great anyway.
Thank you.
So she's already beautiful, and so it's very easy, when you pick pretty patients, you can only make them look better, which is excellent. So when you look at Brittany's face, you can see that she has a beautiful zygomatic arch, which is the cheekbone. But as she turns, you can see that there's turn that way, just a little bit of flattening through here. And I don't know if you can appreciate that, but if we add back in and just make those apples of the cheek through the mid-face more full, it actually does a lot of more rejuvenating of the mid-face. It actually takes the strain off of these parentheses or smile lines and lifts the face without doing any kind of surgery or any intervention besides just a little injection. So I'm going to do that now for you, okay?
Now, have you had this done before, Brittany?
I have not.
You haven't? Okay, you nervous?
I'm not.
You did put a little numbing cream on her.
We put a little numbing cream on her, and I'm going to put a little ice just for a minute.
Okay.
And we've already prepped her skin, so she's clean and ready to go.
And this is filler going
This is filler. This is Voluma.
Okay.
Okay, so I'm going to pinch real quick. A little stick, okay?
Let us know if you can feel anything. Oh, there it goes in. Now, are there any side effects to this process?
So that is an excellent question. So with any injection, we always have the risk of bruising, bleeding, transient swelling, pain. But you could tell, how was that?
I see it. It went
Oh,
up
fine.
a little bit.
Isn't that great?
Plump.
You
So-
didn't even flinch.
No.
Oh my
All
gosh.
right, turn towards me one more time. So we're gonna do one more injection right here.
Okay.
And you can
What
see.
does that feel like? Well, I won't let you speak.
Yeah, let her focus.
Yeah, exactly.
And just putting a little bit in it. Looks like I was
So
thinking
just
you're
a
gonna put the
little.
whole syringe.
Yeah,
Okay.
so we just mark it out, and if she needed more volume, we would do that. But see how it just completes this curve right here and makes her
Yeah.
look much more rested? It actually improves this line right here.
So it works right away.
It's
You see
immediate,
it right away.
which is fantastic.
Now, how
because-
long will it last before she'll need another treatment?
So this lasts 2 years, which
Seriously?
is amazing.
Oh, it does?
Yes, so it's a really great filler.
Touch
and-
it. Can you feel it in there? Because it's just.
So this
Brittany,
is
touch
a deep
the face.
injection, so it's really natural feeling. And the good thing is this is a naturally occurring substance in our body, so it's not foreign. There are other fillers that you can actually feel very deep in the skin, but this is not one of them. So even if she didn't want to give her secret away to her fiance, she doesn't have to, because
Right.
if he were kissing her, he could not feel
If
it.
he
in
wasn't
his
going to see it on television.
So, how much does this procedure usually cost?
So it depends on who's injecting it, but usually it starts about $1,000 a syringe.
Yeah.
But that is quite an amazing price considering that you're getting 2 years of benefit.
Because you always hear about these fillers that last a few months and
Right.
you have to keep going back,
That's
but
right.
this is something different.
So this is something different, and this has kind of revolutionized our ability to make people look younger in seconds. It's
Right.
immediate. They can go to an event that night. They don't have to go under the knife. There's not significant bruising or swelling. And so patients really like it. And it lasts a long time. They don't have to keep coming in every month to improve upon it.
You can literally go on your lunch break and have this procedure
Oh,
done. with your-
right.
Now, I have to ask you, you have some plump cheeks there. Have you ever performed this procedure on yourself?
I have also been a patient, so obviously I believe
do it
in
to yourself, or
I
you
don't
go
do
to
it
see
to
somebody
myself,
else?
because
Oh,
that
okay.
feels a little bit more like a drug addict than I
I also have to ask you, because you see photos all over the press of celebrities who have done too much with the
Right.
fillers. They look permanently surprised. They look plastic at the end of the day. So how do you avoid that?
So you have to really trust your licensed and trained professional and have a conversation with them about what the endpoint is for you. And I frequently will turn away patients and say, you don't need that yet, or that's too much, because we want to make ourselves look young and youthful, but still natural and just like yourselves. So we have to be careful. It's a slippery slope, because
Yeah.
if we think a little bit made me look better, then a lot's going to make me look even better, and that's not always the case.
I wish there were more doctors like you in Hollywood.
And now Brittany can go and work out and not have to worry about it.
She can
Yeah.
work out. She's going to look great and perfect for the wedding, and with little downtime.
Well, don't forget to do the other side of her face after the
I
show.
won't.
But for right now, tell us where more people can find out information about you and your
So
procedure.
if they go to juvederm.com, they can find out about Voluma, Juvederm, the whole family of fillers, and that's what's so nice is, with Allergan products, we can do Botox, we can fill the mid-face, we can fill the smile lines, so you've got all kinds of options to really treat exactly what bothers you.
All right, well, you both look
Brittany's
great.
looking
Thank you so
gorgeous.
much
Yeah,
for being here.
both of you.
Thank you.
All right, we'll be right back with more Rise Entertainment 360. Push that up a little bit.